So the big question is this. We know spontaneous remissions and miracle cures exist. We also know they aren't so spontaneous after all. I'm living proof of this, having cured my quote-unquote incurable illness. There's something to how this happens. So how do we, as humans with chronic symptoms, tap into this so-called miraculous healing capacity? That is the question, and this podcast will give you the answers. My name is Dr. Erin Hayford, and welcome to the Sacred Illness Podcast. Before we begin today's episode, just my standard medical disclaimer. This podcast is intended for educational and informational purposes only. The content should not be considered a substitute for professional medical advice, diagnosis, or treatment. Always consult with a qualified healthcare professional regarding any medical concerns. Hi, everyone, and welcome back to another episode of the Sacred Illness Podcast. I'm very excited today to be interviewing, I think, maybe my first MD, medical doctor. Dr. Tracy Shevell is here with us today. She is an OBGYN in New York, in Westchester, New York, on the New York-Connecticut border. We didn't talk about this, Tracy, but I'm from the East Coast too. So to all our listeners, this is going to be a fast conversation because we're fast East Coast talkers. So sorry in advance. Dr. Shevell is half-time in clinical practice, but the other part of her practice is building up her online platform, which is really all about helping women learn how to heal and be empowered within the medical system. And part of your story is you yourself learning how to navigate the medical system, really learning from that experience. And so I'm very excited to talk to you today from both of those perspectives, as a patient and a human, and then one as a clinician, someone who's been through a health and healing journey yourself. So welcome, Tracy. Thank you so much for being here today. I'm very excited for our conversation.
Thank you so much. Thank you for having me, Erin. I'm thrilled. I just want to start by saying, this whole journey professionally has been very bizarre, right? I realized part of what's allowed me to be open is this career really chose me. So when I became an OBGYN, I never thought that would be what I would do for a living. And also during my residency in OBGYN, I realized that I wanted to take care of the sickest moms, the most premature babies. So I actually did a fellowship in what's called high-risk OBGYN. And what I've realized, and part of why I think that I've gone through my own healing journey and helping patients try to heal differently, is because I've spent my career really balancing both sides of an equation. There are many times during pregnancy where the mother and the baby's interests are in conflict. And I had to figure out what will save the mom may be bad for the baby and vice versa. And so I think just having that dichotomy throughout years and years of practice has put me in a space where I've been, thank God, fortunate enough to not just depend on the patriarchy of medicine that I was trained in, to be willing to be open to other things. Even with the medical system being as broken as it is, I can say with complete confidence that the vast majority of people that go to medical school feel called to want to heal people. And in the patriarchal system that we work in, we make people better. But we need to bring that feminine touch back, because ultimately the concept of healing is so maternal as well. So I just thought that was an important thing to share, because part of what I try to teach women is to figure out how to listen to the other side and avoid being really religiously zealous about your belief system and that one way is the only way. Also, I've spent a lot of the second half of my career, and I'll talk about that very briefly, but I've pivoted right around the pandemic because my career just wasn't the same as it was. Women were disenfranchised from their doctors. They didn't know who their doctor was. They were in huge group practices. And I gravitated toward the people who weren't getting their needs met emotionally. I would walk in and I would say to someone at 8 weeks, there's no heartbeat, and she wouldn't know what to do. And so I'd give her plans to game the system so she wouldn't have to walk around for 3 weeks. And so during the pandemic, the best thing I ever did for my health was to quit. I never quit anything. I was like a rule follower, a good girl. I was like, yeah, this is not working. I have to figure something else out. And I was dealing with my own complex mystery illness at that time, but I spent a few years enmeshed in the stillbirth community. And it was doing that work that I really leaned into the other side of healing, the emotional, the trauma work, the spiritual work. I am very grateful to the stillbirth community for expanding my scope of how to view healing. I was trained as an academic clinician. I worked at big institutions in New York City. I worked at an academic center near my home for 17 years. And when the pandemic came and everything broke and mental health went online, I pivoted and for a short time, did a concierge practice, but I wasn't reaching enough women. And I really didn't want to, no offense to anyone who's listening, I didn't want to just take care of rich people, right? So I wanted to take care of more women. And I realized that this social media thing was the way to start building that platform because
Yep.
women need to know that they're capable and worthy of healing. So much of medicine is not necessarily intentionally, but not thoughtfully taken away from people. Like when you walk into an aisle at CVS, you go into the cold and flu aisle and you see the 57 different medications. No one doesn't panic for a hot second. But the truth of the matter is, there are five medicines in all of those combination, whatever, five generic names that every single person can learn and can walk into that aisle and not be overwhelmed and buy generic products and mix and match themselves. So we just have to be confident enough that we are smart enough to learn these words and learn the language. If a woman has a hysterectomy, we have to be able to empower her to know what her organs are called and what was actually removed and what that means.
Yes.
And we are capable of learning those things. That's the first really important piece. And I think just that involves a level of gaining confidence so that when a woman is at a doctor's visit and says, I have one more question, don't be sorry. They're your partner, your doctor. They are supposed to be working for you. You can say to a doctor without being confrontational or obnoxious, I know you and I are partners in my healthcare, and I know you want to help me. So if you can't figure this out with me, who can? That takes nerve. It's not how women are used to speaking. And it's, again, because medicine is so patriarchal, we are vulnerable coming
Mhm.
into that room. I don't think most men walk out of a doctor's office ever hearing it's just anxiety. And I
No.
think probably every woman has at some point in her life.
Correct.
Mm,
Yes. Part of it is number one, that education piece, because on the one hand, I know when I was young, you grow up with that idea of the doctor knows everything. It's this passive process. I don't have to know anything. They're going to tell me everything. And maybe that worked to some extent, but at some point it shifted into this place of disempowerment where chronic illnesses became more common, these mystery illnesses became more common, and due diligence was not being done. That's where the it's just anxiety really started to become a problem, because when you go into a session with a doctor and you have something that's going on in your body and they're not hearing it or doing further workup around it, that's where having more information is important. And a lot of people I work with will go in and say, I've done all this research and I think it's this or I think it's that. There's this interesting dynamic that can happen where the doctor feels their toes are being stepped on, but it's important to not just be in that passive position of, I don't know, you tell me everything, because that's just not the
right.
way the dynamic works anymore.
That's right. And also, I think that ultimately, a lot of people, especially women, when they're unwell, because they take care of everyone else, there's a certain dynamic of when you go to a doctor, you want to be taken care of. We just take care of people all the time. And that piece is a very hard piece to provide. We look for the ability to put our problems in someone else's hands and have them solve them. And a surgeon can do that. If we've got a hot appendix, someone will save you and fix
Yeah.
you. But when you are struggling with a mystery illness or complex mystery illness, doctors hate not knowing.
Mm-hmm.
And there is a lot of work that needs to be done. And again, this is where the empowerment piece is so important because we know that 80% of autoimmune disease occurs in women. We know that autoimmune disease has a lot of these complex mystery symptoms. We also know that there is and this is in no way blaming women. This is a very important point. We also know that that personality type of the woman who has the autoimmune disease is a people pleaser, is a perfectionist, is an eldest daughter, is a hustle culture, and also most likely had significant trauma at some point. We acknowledge that this is a real thing that leads to disease. There's something called an ACEs score, which is your adverse childhood events score. If you have a very high score, it has been proven that you are much more likely to have chronic disease later in life. And yet, not a single doctor that I know does that as part of an intake. And that needs to happen because it not only is a holistic assessment, but it validates people's trauma and it validates the concepts that are taboo to us, like going to therapy, working on your trauma, telling your friends you go to therapy. I can't have lunch today. I have a therapist appointment. We don't say that to our friends still. I think if we can take away the stigma of these things, we will expand how we can approach feeling better. Sadly, I think the days are gone of getting lucky enough to just find one really good doctor and
I
that's
know.
it.
Yeah. And if you
Right?
do, they're booked out for years because everyone is telling their
That's
friends
right.
and everyone's going to them. This is a universal problem. And I will speak to my profession as a naturopathic doctor. None of my colleagues are doing ACEs either. It's across
Yeah.
the board that no one is looking at that. In naturopathic medicine, we have something called the foundations of health. It's pretty obvious what it is. What are the foundations off of which your health is built? One of the biggest pillars is your mental emotional health, your nervous system programming, your traumatic history. ACEs is an easy way to assess that in anybody. That should be part of every single intake paperwork across the board. And it's not. It doesn't make any sense. We know too much to not be doing that, and yet it's still not there. I don't understand why
Right.
that is.
I don't either. I will tell you that in my world, doctors are as unhappy as patients. They don't want to suffer moral and ethical burnout. And not to play the tiny violin, but doctors are miserable. They want to be helping people, but there's no time and resources. It reminds me very much of when we started doing postnatal depression screening. Everyone was like, yay, let's do it. But then when the screen comes back positive, and you can't get a psychiatrist or a psychologist or a social worker to see someone,
Yeah.
what do you do with that? So I think we're almost afraid to do what with the information when
Yes.
we're having enough trouble meeting the milestones of basic medical care.
Right. That's part of the issue with the system. Even if you uncover this information, there's nothing in place to support that next step. And so you
Correct.
said having that information is almost more detrimental at that point because then you're like, well, we know what the problem is, but there's no system in place to support that.
One takeaway lesson from this, whatever stage you're at in healing, is don't do a test if whoever's doing the test is not prepared to act on the
Yeah.
results, because that is crazy making in a chronic illness journey. You get back these labs and you look up words and you think you have psychosis or cancer. So, my journey and part of why I'm doing this is because I want women to feel seen. I've seen so many stories of women in childbirth, such heroism, such resilience, such endurance, and we are thought to be weak. Let me tell you, I've delivered thousands of babies. Women are fierce creatures.
Yes, we are.
We are strong and we need
Yeah.
to own that. I got sick at a point myself where I was really in the height of the mothering years. I was working. I had a career that I loved. I had a husband. I had two kids. They were young. We had a dog. We had a house. Like it was all good. And I had always had allergies and a bad stomach my whole life. So I'm like the prime candidate. I had childhood trauma. I grew up with a single mom who was very depressed, and I didn't know it at the time, but I had a lot of safety issues. I never really felt safe. Looking back now, what I know to be was a terrible post-viral or post-infectious neuroinflammatory illness. Now I know the words for it, but I developed mast cell activation syndrome, dysautonomia, and I have hypermobile spectrum disorder. And these things I've all learned along the way. But to put it in brief, I would wake up at 3 in the morning with my heart rate in the 120s, shaking, nauseous, thoughts racing. I saw a million doctors. Everyone's like, I think this is just anxiety. What I started to notice was these symptoms would happen in periods of time and they were cyclic. It would stop, it would
Hmm.
break. The fog would lift for 2 weeks, but then it would be back. It was the most traumatic time of my life. I felt brain fog. I was working and then I'd go in the bathroom and I'd throw up and then I'd come back to work. I really started to realize that all the doctors that I was seeing, they were treating the flood downstream, but nobody was getting to a root cause. And so my path led me to a very well respected functional medicine doctor who was wonderful. Now, here is one thing where people may not feel seen, which is really hard. I spent a lot of money in that time because a lot of these doctors don't take insurance because they don't have to.
Yep.
And sometimes that's because they have answers, but not always. Also, because desperate people walk in and they pay money to see doctors, and then the doctor says, I will cure you. You need to go buy these 8 supplements at the front desk.
Yep.
That's another takeaway point. If anybody is going to get you better with what they are selling in their office that you cannot buy anywhere else, that's not the answer. It was not obscenely financially problematic, but people do spend so much money when they
Yes.
get to that point. I don't know that I did any more than most other of my friends who I've met and engaged within the chronic illness community have done, but it's really hard.
Mhm.
And there are some incredible doctors I've seen who do take insurance or who do have payment plans. And he found something in my lab work that was suspicious to him. Thought maybe I had chronic Lyme.
Mhm.
Went down the chronic Lyme rabbit hole, but found myself in the office of someone who was a brilliant, I knew enough to know he was a brilliant clinician who looked at me, heard my symptoms, and he said to me, "This is not anxiety. You have something, I think you have a post-Lyme neuroinflammatory picture." And
Oh,
he did a test that was not mainstream, that is much more mainstream now. He saw the test result come back and he said, "This is the worst case I've ever seen. I don't know how you're walking." He wanted to put me on doxycycline for months and months. And of course, that doesn't do well for your stomach. And then wanted me on IVIG, which is IV immune globulin, which is super hard to get approved by insurance and super expensive. And he then said to me, "You'll need your doctor to just back you up because there are side effects." And that was my first fork in the road. I knew in my gut that he was onto something real. This is the treatment. And then I had my doctor
oh,
and I had a psychopharmacologist I was working with at this point. And they said, "This is bullshit.
oh,
Never heard of this. You need to be in therapy twice a week, need to
oh
be
my God.
taking meds. This is severe anxiety."
Oh my gosh.
I do not think you need a medical degree to make the decision that I made. I had no choice. I couldn't go rogue. I couldn't afford the treatments. And so the decision I made at that point, which a non-doctor could make, is
Yep.
I figured out how do I implement other systemic ways of treating what he's talking about. And so I went on a very strict anti-inflammatory diet. When my brain wasn't burning, I started to dive in and research. And the type of research that I did is the type of research that doesn't have to be done by a doctor. So much of the research in this fringe space of medicine are people who are not physicians,
Yep.
who are taking their health into their own hands, who are desperate for an answer besides psychiatric meds. So I went into therapy twice a week and I worked with a therapist who was wonderful when my mother died,
Mm.
but then wanted me to come more. And there comes the next lesson. Whoever is taking care of you must believe in your ability to get better. There was such a level of enabling. And that was the second brave thing I did. I quit her.
That's
At the same time, I'm working on the gluten testing and I was pursuing functional medicine testing to see, should I really be gluten free? Do I really have dairy allergy? I was always looking for all the answers. And then I started working with a trauma therapist and we've been working together for 5 years and we've done EMDR, which stands for eye movement desensitization reprocessing. It's a modality of therapy where with bilateral stimulation, you reprocess old traumatic memories to change how your body feels them in real time. Your body's holding on to trauma. And there's no question that part of my slow getting back to a really functional baseline was my trauma work. And I continue to do it because I'll do it until there's nothing left to unpackage. And around the same time, I really leaned into spirituality. I'm a Jewish person. I believe that there is a God, a source, spirit, whatever you want to call it. But I needed to believe there was something greater. And I am very open to all kinds of woo. And I will say for the record, there are quacks, but there are people who definitively have talent. There are certain channels, there are spiritual advisors, there are life coaches who can complement the approaches that we take to feeling healed and held and seen. And so it's really just been a long and complicated process of that. And COVID changed the landscape for complex mystery illness. There's a tremendous amount of long COVID and COVID vaccine injury that's introduced these concepts. And now mast cell's a thing. When I got my diagnosis, it wasn't yet a thing. I just knew I had it and I was going to find someone to prove it. But the rest of the picture now is making it far more mainstream to talk about and understand. So I'm grateful for that. But I still struggle all the time. And I'm at this stage in my life, and this is where I found your work. I'm at this stage in my life where I want to teach my body at a systemic level, at a nervous system level, that maybe it's okay to shift out of this mindset of who's going to fix me and shift into radical acceptance. I'll keep doing the work. I may have flare-ups, but after the flare-up comes a good day. And I want to lean into that piece and try to make sure that the people that hear my story or read my book, God willing, next year, feel like if a doctor can talk about somatic work or nervous system retraining and it's not medical, but she's a doctor, if that has any weight. I never use my doctor card because it doesn't do anything. I don't get better parking spaces and I don't get discounts, but I will use my doctor card for this. So if it can help women heal to see a truly academically Western medicine trained doctor embrace and encourage you to explore naturopathy, functional medicine, integrative medicine, spiritual work, I think that's really, really important.
Hi, Sacred Illness listeners. Dr. Erin here. If you are resonating with the stories and the things that you're hearing inside this podcast, and you're curious how to begin this work yourself, how to start connecting with your illness in this different way, to start seeing it through a different lens, to start being in relationship with it versus seeing it as an adversary or something that you have to fight against, I would love to invite you to join us inside the Sacred Illness community. This is an online space I've created exactly for that. It takes you step by step through a process to decipher the message of your body, to understand what your symptoms are trying to communicate with you, the subconscious patterns and the belief systems that have been imprinted and programmed into your nervous system that are now creating the conditions in your body that are not conducive for healing and in fact are likely creating the illness and the symptoms that you are experiencing now. Within this community, you will learn all the things you need to do to begin to rewrite those stories, to rewrite those nervous system patterns, to understand on a deeper level what it is that's driving your body to create illness and to move in this direction of disease, and how to reverse this process and begin to work with yourself in this more holistic, loving way versus fighting against a body that you're perceiving perhaps to be failing, when really illness is this beautifully wise communication trying to get you to tune in and listen in this new way. Everything contained within the community is self-paced, it is affordable, it is easily accessible from anywhere, it can be on your laptop or on your phone, and it allows you to add this element that's foundational to your health and healing process in addition to anything else that you're doing. This work is complementary to whether you're taking pharmaceuticals or just pursuing more holistic type treatments. Whatever you are doing, this nervous system, mind-body piece is foundational and needs to be part of your treatment plan. So if it's not, the Sacred Illness community is a really easy and really important way to get this part of the work into your routine. If you want to learn more, you can click the link down below in the show notes that will lead you to a full description of everything that's included in the community. Or if you're ready to just sign up today, you can go to mysacredillness.com, follow the prompts, and you'll find your way into our space. It is my mission and my goal for everyone who's listening to this podcast to feel a sense of hope that you're not broken, your body is not failing. It is a beautiful, intelligent communication that is taking place, and the Sacred Illness community is the space and the place where you can begin to decipher that message and find your way back to the health and the healing that you deserve and desire. So I hope to see you in there, and for now, let's get back to the podcast. It's empowering because it shows like a humanness to something that can feel algorithmic and detached from our lived experience. When we have this intuitive feeling of this is what's going on with me, I don't know what the name of it is, but I know this is happening. And we see someone who doesn't mirror that back or who downplays it or invalidates it, it's reinforcing probably the trauma that was part of the illness production in the first place. And that's why a lot of us don't know what to do, because this is what's being invited to be healed, to reclaim our power and reclaim our voice and to be seen and to be heard. And so the journey is a lot of believing in yourself enough to pursue the people, places, and things that will validate you and allow you to be seen and heard in the way that maybe no one has ever given you before. And I'm so curious, what is it about some of us who are able to break out of that cycle of to find the person who listens to us? What is that in us who don't give up and who keep pushing? Because it's so easy to give up. And I don't think a lot of us see it as giving up. It's just, this is how it works. This is the medication. This is the treatment. And we just go with whatever we're told. But for those of us who have that inner knowing of this can't be it or this can't be right, and we keep going, I think that there's something very powerful to that. And that's what you're speaking to. It's what you're trying to help women understand, is how to speak and think and advocate for ourselves to break out of a cycle and to find the things that are going to support us in the way that we need.
Correct. And you said something that I think is so poignant and powerful, that when we struggle with complex mystery illness symptoms, brain fog, joint aches, they're not fever and rash,
Mm-hmm.
let's just say, or they're not a GI bug where you're throwing up. It's very, very hard. There's a tremendous amount of baggage that comes along with your intimate family, with your intimate loved ones. Can you just get up and rally and come to dinner and you can't move off the couch and you feel like you're dying and you don't look sick or you look functional? And so it's hard for people to feel like they may even be getting that sort of support at home, even in the most well-intended people. If you don't understand it and you haven't felt it, you are forced to lean into yourself. And that's really hard.
Yes.
And that's part of the reason why the more we talk about it, the more we can lean into other people going through the same things. It is so hard to trust our intuitions when we're tired and sick and tired of being sick and tired. And we just have to try to keep going. A woman's intuition has been buried for a
Yes.
long time. We do it for our kids. We have that mama bear thing, but wouldn't it be nice if we treated ourselves like our own child? Not to bring the inner child into the dialogue here, but
Yeah.
seriously,
Yep.
the treatment we accept for ourselves, we would never accept for our kids.
No, say that to my clients who are parents. The way that you are talking to yourself or in relationship with these more vulnerable aspects of yourself, it is a younger part of you, the part that is wounded or hurt or sick or reactive or triggered. There's some inner child aspect of you who is there. It's a really important mindset shift to have. You said something really important too that I want to highlight, which is how you took what that functional medicine doctor was saying to you, like, this is the problem, this is what needs to be treated, and you found how to work with that within your own means, within your own resources. I think that's incredible, because that's the mindset people need to have, getting out of that one problem, one solution thing. And even if the
Totally.
doctor who is actually helping you is giving you a solution, it doesn't mean that's the only way to work with that problem. It opens the door, right? It's like, okay, now you have information, you know what's going on in your body much more than you did before. There's still thousands of ways you could work with it. You could go to a
That's right.
shaman in South America and do similar stuff, right? It's just a
That's
matter
right.
of you now figuring out what works for you financially, emotionally, spiritually, mentally. What can you find within that that is going to support you? And that's what you did, right? You piecemealed it together and found what worked for you, which is so important for people to hear.
Yeah, and there's no one right way. I think that it's really important if you do have a medical thing going on and you eventually figure out medically how to deal with it. There's so much trauma that you experience going through that stage of
Yes.
dismissal, no answers, feeling like you're sick and nobody can fix it. You can't figure it out yourself. If you're really healing from something where you were gaslit, dismissed, you will have trauma whether you had it to start or not. And you will feel spiritually depleted whether you walked in that way or you didn't.
Yep.
The illness itself begets more trauma. And also, you have to be willing to let people make fun of you a little bit. When I started working with a channel many years ago, she was a bit more of a life coach, but gave very directive instructions. My husband and my kids were like, "Ooh, did the guides tell you to eat that?" Or like, "Ooh, don't touch mommy's bottle of oil." And I'm like, "Don't touch my bottle of oil."
You're like,
Right?
yes,
But
correct.
correct. And honestly, I don't really give a shit.
Yeah.
Like, I don't care. If I can be better for you, if I can feel better for you, and any of this works,
Yep.
I don't care.
Yeah.
I don't care. And, I find it very interesting, and this comes up a lot, and I touch on this in my book. We will be places where I will hear something that I heard from one of the energy healers I went to, for example. And it will be reiterated when we're in temple or we're listening to a podcast. And I'm like, you hear that?
Mhm.
Common theme is coming up. You can't dismiss everything
Yep.
that doesn't make sense to you.
Right. Yes. There's sort of two sides to that. On the one hand, if family is, like you were saying, even with good intention, being like, well, just get up, you don't look sick, come on, rally, kind of putting that guilt trip, again, probably not intentionally, on you. There's an incredible importance in finding people who do see you and who, I love what you said, believe in your ability to heal, surrounding yourself with that belief in your capacity to heal. Because if you are surrounded with people who are putting that pressure on you to just be yourself or get back to normal, we need to be able to fall apart. When we're sick, we need to be
Totally.
allowed to be sick. We need to be allowed to be authentically however we are feeling in our body in that moment. 9 times out of 10, from what I see from my practice, that is part of the problem. Part of the problem is that we are
Totally.
not being ourselves. We're not being real with how we feel. We're putting on a mask, pushing forward, overriding our feelings and our energy, especially moms and women. And we're forced to be this sort of person. And that's part of what our body is trying to say, like, hey, please stop. I'm exhausted. I need more food. I need more water. Whatever that is, our body's trying to talk to us. That's part of the invitation of the illness, is to say, this is your opportunity to really be yourself, to really ask for help and let yourself be seen and be vulnerable and be a human being. And again, part of the family or the loved one thing is, of course, they don't want to see us suffer. And that speaks to the bigger cultural issue of our inability to be with pain and suffering. We all just want to push it away and
Totally.
pretend everything's fine.
I think also to your point, there's so much I could say about all of this, but to that very same point, it is an invitation to maybe sometimes sit down and listen to your body. And sometimes if a family member who means well is like, get up, get off the couch, sometimes we have to take them and sit down and be like, this is what I'm feeling.
Yeah,
This is how unwell I feel. This is exactly the symptoms I'm having. Like, really spell it out and be like, I know it's frustrating to not have an answer. I know you want to help me and I know you don't want me to not feel well, but I need a teammate in this.
yeah,
Like, to really own what you need. At least you feel like you've made your needs clear, even if somebody doesn't know how to meet you with what you need. Just
exactly.
saying it and spelling it out sometimes is liberating and strengthening.
Totally. Yeah. It's really a reclamation of your truth, your power, your voice, all of that. You're being pushed into that for better, for worse. And that
Yeah.
goes with the whole doctor thing we were talking about too, where you have to keep trusting your intuition and find the people who will do the tests you need or listen to what you're needing or just take you more seriously and not just saying it's anxiety. It's hard because we're saying a big part of
Totally.
this is that persona that can often be the people pleaser or the person who says everything's fine. So it's basically asking you to do an about face and become someone you've never been before. I think illness is this interesting catalyst because what's the alternative? We're in a place where we're sick, we don't feel good, we can't live our life the way we used to. It forces you to change. And to me,
Totally.
that is I call it a gift of illness, which I know can be a challenging way to think about it, but it's a backhanded gift because it's saying, this can't go on, and illness is a fork in a road. And so you have this choice to either continue on pretending everything's fine and probably continue to get more and more sick, or learn how to advocate for yourself, learn how to speak up for yourself, talk to family members in the way that you're saying, and see where it goes from. I mean, to me, it's like there's no real option except to do that, even though it's the most challenging thing you can probably do.
Absolutely. And I think that if you don't face your trauma will somehow face you. It's really hard to outrun it. I did want to make one other logistic point about self-advocacy and how we obtain information in a way that we feel comfortable consuming it. One of the things I always tell my followers online is if you want to look something up, think about what you're going to Dr. Google or now what you're going to put into chat. Don't ever look up a symptom because you look up a symptom and you're dying of something
Everything,
horrible,
yes.
right? But you can get an idea of this is my constellation of symptoms. There's a doctor named Erin Nance who does a lot of patient education, who I have a reel up on my feed actually, who suggested that one of the best ways for lay people to understand disease is to go to a medical search engine called PubMed. And you can put in your symptom and you can put in what you think you have, and you can have all these papers, all this information.
Mm,
And you can look at the doctors who are on those papers. Maybe those are specialists, and you can email one of those doctors. The only caveat is that it's heavy doctor speak.
yes.
But here's where the future of medicine has a chance to be positively affected by AI. Because if you take complex information and you give it to AI, like ChatGPT, you can say, put this paragraph in an 11th grade reading level for me. And you will then have something that you read. You can't ask AI to solve a medical problem because a lot of times it hallucinates. It makes up a source and you go to the source, you're like, this isn't a source.
It's scary in that way.
It's very scary and it's misleading. So I always say be careful searching your one symptom, but if you have a constellation of things, that's where PubMed can become helpful and make suggestions. You don't have to be a doctor now with the advent of AI, and I think this is going to be more and more of an issue in a good way. So if AI can replace a lot of this grunt work and also add a lot of educational information at levels patients can understand, that's going to be a game changer. And maybe that will allow the process to be streamlined enough that there's a solution for how to get an ACEs score into every exam. The other website that I've really started using recently a lot, and that's clinicaltrials.gov. So if you're looking at an experimental medication or you go to a doctor who wants to put you on some medication you've never heard of, you can see in clinicaltrials.gov, have there been any active trials on this? Are there any ongoing now? You can reach out to the primary investigator. It's one that I've newly started using and it's really fascinating. I looked up a supplement for myself that I had heard
Thanks
about
so much for
on
tuning in to another
Instagram
episode
last
of the
night.
Sacred
And
Illness
there is like
Podcast. If you
70
find
years
this
of data on
information
it. It
shared
looks
here
like
inspirational,
everybody who has
educational, please share it
neuroinflammation
with
should be
those you
taking.
think
I'm
would
like,
benefit
okay,
from this
cool.
work. Amazing.
You don't
To
have to
take
be a
this work
doctor to
deeper
do
yourself,
that.
check
One
out
of the
our
things I talk
website,
about all the time is to have a friggin' notebook or just a medical
www.aurorasomatic.com,
notebook.
where you can
I know
explore
that
our
there's a lot of
coaching,
pushback. We don't
community,
need to
and
see the
course
OBGYN every
options.
year because they
And
do
don't
more
forget to
tests.
subscribe to this
I think
channel where
the
new
way that every
content is
woman
coming
can
out all the
have
time,
as close to a
intended to
concierge doctor as
inspire,
possible is
awaken,
when she
and
turns
help you deepen
20
your
or
relationship
18 or
with
19 or
yourself,
whatever,
your
see
life, and your
a
world.
primary care
We'll see
doc
you
and an
next time.
OBGYN every single year because you will have, when you are 40, 20 years of charts. And those charts can eventually be fed into AI and can be summarized. And so, I think these things are really important, even if you think you don't need to. So the notebook isn't sexy, but it's advocacy. I think hacks are important because it's hard to talk about something and not give practical tools.
Totally. And I think part of this mindset shift that you're advocating for is healthcare can't be passive anymore. We can't be passive participants in it. You spoke to this in your own journey of not just having you fix me or this fixes me. It's moving out of that mindset and recognizing that ultimately the healing that's going to happen, we have to be an active participant in it. We have to have a mindset around it. We have to have an understanding of it. We have to be in communication with our bodies. We have to know what's going on. We have to be in our body, feeling things and processing them and sensing them. And to me, what healing is this deepening intuitive connection to ourselves, because I think so many of us get sick from a place of being like talking heads, right? We're detached from our bodies. And I know you and I are similar in that academic, just learning and going so deeply into academia. That was my whole first half of my life, just learning and being detached from my body. And then eventually the body's like, okay, hello, can't do that anymore. You're sick now. And it like forces you into your body. But I think that's part of this journey is how do I become an embodied human being connected to my whole self, in communication with my whole self, so that I feel something in my body and I know what part of my body it is. I can sense what's going on. I know, oh, this is just hunger, or, oh, it's just a gas pain, or, oh, no, this is actually a new thing. I've never felt this before. We just have more of a connection to ourselves. And from there, we are immediately more empowered. If we're going into these appointments being completely disconnected from ourselves, not aware of our body or what's going on, then we're at a disadvantage. Our health is ours. A doctor is there to facilitate and lend education and obviously prescribe and do labs and things that we don't have the license for, but it's a partnering, and you are bringing almost the most information to the table because it's your body and your history and your life. So we have to be the advocate in that way too.
That's right. And what is also so important is if your doctor has ever said to you, I think this is just anxiety. If you introduce yourself, this is my story and this is what I'm worried about and this is what I'm feeling today. And your doctor says, maybe you're just anxious. I tell people to say, well, I'm in therapy. My therapist thinks my anxiety is well controlled.
Ooh, love that.
Right?
Yes.
And if you don't have a therapist, say it anyway. It immediately takes away the blanket diagnosis.
Yes. Yes, love that. And it kind of puts them in a corner of like, okay, I got to do a little bit further look up and research here. At the beginning, I had asked you some key points that we want to touch on. One of them was that you had said, I really want people to understand that there is a problem with the system. Some of the problem is the doctor-patient interaction. Is there anything you want to expand upon there?
I think we did touch on it. I do think that it is very important to realize that you will be met with doctors who are just jerks. And at the end of the day, I think the best thing you can then do is do not stay in any kind of relationship with a physician. There's never the only one,
Yes.
right? So you can always change. Your doctor's ultimately working for you. But if you do move on, it does a tremendous amount for your psyche if you write a letter and you say to
Mm,
them how they made you feel. And guess what? If you go to a doctor that works for a system, you can write to their superior. I had a particularly awful experience many years ago with a different illness that I wound up diagnosing myself for.
mm,
And I sat in the office with a cancer doctor because I was being worked up for lupus.
well,
And he told me I had lupus. And I was like, really? Because my other doctor thought this was an infection. And I did all this research as a doctor,
yep.
brought him a case study and said, maybe it's this. And he sneered at me and said, "Pfft, I mean, I've never heard of that. So I don't think that's what you have. Lo and behold, of course, that's what I had.
Yeah.
And I wrote to him and I said, you are a cancer doctor. You cannot, if somebody comes to you with an article, you need to hear them
Yep.
because you can't take away someone's hope. So again, if you don't have a doctor who gives you any sense of hope, and you don't have a doctor that makes you feel like they can make you get better, then those things need to be addressed. Part of
Yes.
being an empowered patient.
Absolutely. I'm sure you can relate to this. When I was in school and looking at my classmates, it was like, oh, that person's going to become a doctor. Like, we're just people, right? Like, we're just people.
Yeah,
Anyone can become a
correct.
doctor, literally anyone. Just
Mhm.
because you have, so much education and letters after your name doesn't mean jack shit, to be honest,
Totally
right?
agree.
Like, it's just
Yeah.
learning information and passing a test, and there you go, you have a license. Obviously, there's so much more that goes into it than that. I'm not trying to downplay it, but there's also some simplicity to this. And I think it's really important. You said the word relationship. That's exactly it. This is a relationship like any other. And if you are in relationship with a doctor who continually makes you feel stupid or doesn't listen
Mhm.
to you, dismisses you, why would you be in relationship with someone like that? Move on and
Correct.
tell them why you're breaking up with them. Like you said, you would tell a partner, I don't want to be with you. And here's why. Do the same to your doctor, because if for nothing else, it's advocating for yourself, it's using your voice, but they need to hear
Mhm.
it too. People need to understand why it is people aren't coming to see them. And maybe it will never shift anything for them, but maybe it will. And maybe it will save someone
That's right.
else the issue down the road. And the other thing you had said was that healing for women is not just about a pill. There's emotional layers, the spiritual layers. You had said it's completely reinventing who we are. Is there anything else you want to say around that?
Yeah, there's so much emphasis now on talking about perimenopause and menopause and moving out of these years where we do so much for so many other people. And, in this culture that we live in where everything is glamorized and women are sex objects and commented on for their beauty, we're always criticizing ourselves. But menopause is really a chance to step into an era of figuring out what makes you light up. There's less responsibility of mothering. We may not be able to procreate anymore. So for a lot of people, they worry, will I not be worth anything?
Mm,
In many cultures, you're worth everything. We really do need to own this third stage of our life as the wise woman. As a society, when we talk about women's community, we really need to look for things to light us all up, like intergenerational friendships or embracing the role of like, wow, this is the first time I've had to think about myself in a long time. It's another opportunity to reinvent yourself. So I think that's really important. And it's not just about, oh, I'm in perimenopause, so I'm allowed to be angry and throw things at everyone.
yeah.
Like, right? It's also about maybe you have time to figure out that mystery symptom that's been nagging at you. And then maybe all of a sudden you may feel better because you're doing something that lights you up. You're painting again or whatever it is you're doing, but you got to give yourself a chance to reinvent.
I love that because your way of thinking of menopause is how I think of illness, which is, yeah, an invitation to reinvent yourself, to find yourself again, or maybe for the first time. It's just this like,
Beautiful.
yeah, what lights you up? What brings you to life? This is the time for that. That's so beautiful. I'm so grateful for us finding each other and your
Thank you.
advocacy work and your story. It's nice to see that we're all just humans. We're all just people with letters after our name. We all have emotions and stories and traumas and illnesses and challenges in our lives. And within the medical system too. It's no different for anyone across the board. And I like to ask everyone at the end of my podcast, who is your illness inviting you to become? Who do you think your illness invited you to step into or evolve into as you healed?
Oh, God, that's such a beautiful question. For me, it really allowed me to turn all the pain that I'd been through in my life. I think that sort of culminated physically into purpose,
Mm,
advocating for myself, realizing what it meant to heal, I feel very lucky that my career ultimately led me to my own sovereignty. I'm still working on it, but
Yes.
ultimately, I think that was the gift in that black box.
Yes. And now you're passing it on, right? You're giving that to women through your work. It's beautiful to see that reflected in your own journey and what you learned. And now you're giving it to all of us. So thank
Thank
you
you.
so much for being here, Tracy. It was a pleasure to talk with you. And I'm so grateful for your work and your advocacy and sharing everything with us today. I'll put all your links down below. Tell us about your book too, please.
Of course. So I am on Instagram. I'm on Substack, which is new for me and super fun. The book that I have coming out next fall, it's actually coming out October 6th, 2026. My God. It's like my third child. It's like literally feel like I'm having a third baby, which I kind of am.
Yeah,
The book is called Labor and Deliverance. Subtitle is Still Discussing. And I picked the title because really it's, through my own work, through my own labor, I found a sense of deliverance. And I hope that other women can too. It's 9 patient stories of some very heavy and very profound things that my patients have gone through. It's their stories that I needed to share with people who have gone through the same or worse. And it's woven in with my own illness journey, the lessons to be learned along the way, and how we can put them into practice.
that's incredible. I'm so excited to read that. And will this be announced, I'm sure, on your social pages and website so people can follow and stay tuned for that?
Yes, for sure.
Awesome.
Absolutely. I think the easiest way to stay connected is that I always worry that one day Instagram's going to break. So I'm encouraging people to go to Substack, sign up with their email. How Substack works is there's a snippet where you can read the first part where it's free, and then you can subscribe for whatever the nominal fee is
Yeah.
and stay engaged.
Perfect. Awesome. So all those links are below to be in touch with Dr. Shevell and to stay up to date with her book and everything that's coming forward and to get all the hacks on how to advocate for yourself and find your voice in your way through the medical system and menopause and all the things. So thank you again for being here. It's been a pleasure talking with you today.
Thank you so much.
Hey, everyone. Until next time. Thanks so much for tuning in to another episode of the Sacred Illness Podcast. If you find this information shared here inspirational and educational, please share it with those you think would benefit from this work. To take this work deeper yourself, check out our website, www.aurorasomatic.com, where you can explore our coaching, community, and course options. And don't forget to subscribe to this channel where new content is coming out all the time, intended to inspire, awaken, and help you deepen your relationship with yourself, your life, and your world. We'll see you next time.